running a primary care unit in Castelldefels, 20 kilometers south of Barcelona. We are running also an emergency primary care unit and a nursing home primary care unit, carrying about 200,000 people in the emergency unit, around 36,000 in the primary care unit, 700, 800 for the nursing care home. The importance of digital skills has been basic, and it's been a long story since, as you may know, primary care in Catalonia is developed through primary care teams that include both doctors, nurses, social workers, health assistants also. And when we started 20 years ago, the story was quite different, 25 years ago, because we were working with paper, a bunch of papers, and even the prescription was on paper. That changed around 2000, and when we started in CASAP in 2005, we started already using the Catalonia e-health record system. That was the ECAP. And the ECAP has been a success story, despite many professionals, as Dr. Clements pointed out before, were rejecting the use of these web pages. But it has helped a lot, not only for the e-health record that it is, of course, but also because it facilitates the team building. Team is necessary, needed, and is essential to primary care. Working together, nurses, doctors, is essential, and working all together in the same web page is something in the same APP is really, really essential to build teams and build a strong primary care. This e-health record has provided continuity, has provided comprehensiveness for every activity that's developed from different professionals' point of view in the primary care. It facilitates the access to imaging, both X-rays, MRI, whatever. It also has facilitated coordination between primary care and hospital level in the continuity of referrals and online referrals. And it allows also the feedback from warnings for drugs interactions and so on. So this has been really, really useful to develop later on a connection between primary care professionals through teledermatology, asynchronic consultations, or even the evaluation of the diagnostic tests developed in primary care and evaluated by hospital care. The challenge, now the doctors are keen on working with this, but they are to work on different aspects at the same time, caring for the patient and caring for the e-health record. That is a real problem that may make the professions reluctant to go on working on it, and it's needed to be facilitated. As for the providers or the health authorities, this system has been highly useful because it provides enough information for managed care. A problem is when this is useful for the government and not that useful for the specific health providers. And as for the citizens themselves, it's really, really useful because they may get online scheduling and also online accessibility to their health data. Nevertheless, the interpretation of this data needs still some access directly to the professionals. And it's another thing that I guess that in the second question we are going to deal with. So we are to work on improving the clinical managing for all these data, and we want to work on the digital literacy, both of professionals on one hand, but also for the whole of citizens, to avoid that this clinical tool changes to a chat conversation.